Hello, my name's Mike Ralph. I'm a registered nurse in the emergency department here at UVA. I'm here to talk about hand washing today. Flu season is upon us, and not only the regular seasonal flu, but we also have the H1N1 virus alongside. So hand washing is the best protection against viruses. 80% of communicable diseases are transmitted through touch. So hand washing is that important. Now, we need to wash our hands before and after every patient contact, before and after putting on gloves, and certainly using soap and water if dealing with any bodily fluids. And if you're at a health provider's office, it's okay to ask them if they've washed their hands too. And your own healthcare provider needs to wash their hands before and after every patient contact and before and after putting on gloves. So, right now I'm going to demonstrate the proper techniques in hand washing. Okay, so the first thing we need to do is get the water running. Not too hot, but not too cold. You definitely want to use warm water. There we go. Get some soap, about a dime's worth, perfect. And then you just rub your hands together quite vigorously. It's the friction that's going to kill the germs. You need to wash your hands for about 15 seconds, getting in between the fingers, the whole hand, and under the nail beds. You're going to also want to wash right down to your wrist. You know, it takes about 15 seconds to sing Twinkle Twinkle Little Star, so if you're teaching your 4 or 5-year-old how to wash their hands, you can use Twinkle Twinkle Little Star, and that gives you the 15 seconds necessary. So I'm certainly done 15 seconds worth of hand washing, so I'm just going to rinse off my hands. There we go, all the soap is gone. I'm going to want to use a clean paper towel to dry my hands off. And there we have it. You know, germs can live on hard surfaces for over 72 hours, and even though we're using soap and nice hot water, the faucet's not necessarily clean. So I always use a paper towel to turn off the faucet, and then you can just throw the paper towel away. So after you finish washing your hands and you're in a public restroom, you'll want to use your paper towel to open the door so you don't contaminate your hands. So you can just go ahead and then throw the paper towel in the garbage. If you don't have access to paper towels and you've just finished washing your hands, you can use like your baby finger of your non-dominant hand to open the door, and you're contaminant free. So hand sanitizer is a very effective way to combat germs. If you don't have access to soap and water, you can use hand sanitizer. You put a fair bit on, and just like washing your hands with soap and water, you get them all across your hands, in between your fingers, in the nail beds, and all the way down to the wrists. Now, it should take about 15 seconds for the alcohol to dissipate, but when they're dry, you are good to go.